Pause the video and try your hand at answering this case. Then we'll work through the questions together. This is a classic case of mitral valve disease, MVD, with congestive heart failure, CHF, in a Cavalier King Charles Spaniel. Answer to question 1. The most likely diagnosis is mitral valve endocardiosis, myxomatous mitral valve disease with left-sided congestive heart failure. The mitral valve normally prevents backflow from the left ventricle into the left atrium during systole. When it degenerates, it becomes incompetent and blood regurgitates backward. This increases left atrial pressure, which backs pressure up into the pulmonary veins, then the pulmonary capillaries. When pulmonary capillary hydrostatic pressure exceeds oncotic pressure, fluid leaks into the alveolar interstitium and eventually the alveoli, producing pulmonary edema and the crackles you hear on auscultation. The grade 4 murmur reflects turbulent regurgitant flow back across the diseased valve. Answer to question 2. When cardiac output falls, the body activates compensatory mechanisms through the sympathetic nervous system and the renin-angiotensin-aldosterone system, RAAS. Sympathetic activation increases heart rate and contractility and causes vasoconstriction. RAAS activation causes sodium and water retention, increasing blood volume and preload. Initially, these help maintain blood pressure and organ perfusion, but in the long term, they are harmful. Sodium and water retention increases preload on an already failing heart, worsening pulmonary edema. Vasoconstriction increases afterload, making the left ventricle work even harder against a closed mitral valve. Chronic sympathetic activation causes adverse cardiac remodeling. This is exactly why the mainstay of chronic heart failure treatment in dogs includes diuretics, furosemide to reduce preload and pulmonary edema, pimabendin, positive inotrope and vasodilator, and ACE inhibitors to block RAAS. Each drug targets a specific physiologic mechanism.